Hi, everyone. This is Tom McMillan with LEAD1. Thank you for joining us today for our 30th webinar since COVID. I will just be introducing everybody for a minute, and then I'll kind of go off the screen. But before I introduce everybody, I want to have Hannah go over some of the housekeeping items. Hannah?
Good afternoon, everyone. For those who have yet to join a LEAD1 webinar, I just want to take the group through a couple housekeeping items before we get started. First and foremost, all attendees other than panelists will remain in a listen-only mode for the entire discussion. However, if you would like to speak or ask a question, there are a number of ways in which you can do so. First of all, you can use the raise hand function. This is part of your control panel. Depending on the device you're using, this will show up on either the right side of your screen or on the top or bottom toolbar. This will notify me to recognize you and unmute you individually. Second, and by far the most popular way to ask a question would be to message me directly in the questions tab, again, part of that control panel. These questions will be read aloud and that attendee will remain anonymous. And finally, you can also ask the question using the chat box, again, in that control panel. However, please note that anything written in the chat box will be seen by the entire audience. I'd also like to make the quick point and note that today's discussion is being recorded and will be distributed alongside a written recap within 24 hours of the conclusion of today's discussion. With that, I'll pass it back to Tom.
Thank you, Hannah. And the topic today is returning to the courts and classrooms, considerations for college basketball in the age of COVID-19. Now, we want to thank our sponsor for being part of this Eurofins. And today we're going to talk about a number of things around basketball and COVID. So without further ado, let me introduce our moderator, Joyce Gresko, who's been with us before, who's a partner at Olsen & Bird, and then she will in turn introduce the other panelists. Joyce, it's all yours.
Thank you. I'm very happy to be with you today, and happy to be with my partners and client at Eurofins. I've been working with them for several years on a whole bunch of different things, and lately it's been a lot of COVID work. With us today are David Morgan, who's the president of Eurofins Transplants Diagnostics, and then we also have Troy Ayers, vice president of sales for Eurofins Microbiology, and we're all in different locations today, California, Florida, and Washington, but hopefully we'll be able to share with you a little bit of what we know about testing and answer some of your questions if you have any. Okay. And Hannah, there we go. Do I have control of the slides here now?
It's looking like we're having some tech issues there. Joyce, feel free to just go ahead and cue me if that's all right.
Okay, well, you can go ahead to the next one. Thank you. My job today is to do a really quick level set on the types of COVID testing and where it can be done, different kinds of specimen types, also who pays for testing, and then different considerations when you're working with a lab and putting together a testing program and the other components of your program. Then I'm going to turn it over to my partners from Eurofins to talk about some of the nuts and bolts of these kinds of programs. Next slide, please. Okay, so really quickly, some of you may be familiar with these different kinds of COVID tests by now. Some of you probably have had one or more of these before. The gold standard really is a PCR test. So this is to diagnose an active case, and you're looking for genetic material from the virus. These are typically performed in a reference lab like Eurofins. A rapid or point of care test you can get is an antigen test, and this is a test that's looking for protein fragments. Typically these are done in a physician's office or a hospital, but they're also, it's also possible to do them sort of wherever you are when there's a critical mass of people to be tested and it's possible equipment to that location. So it doesn't have to be in a physician's office or hospital. And then also an antibody test or a serologic test. Basically, it answers the question, are you now or have you ever been infected with the coronavirus? This is a blood test. And this is done in a reference lab or a hospital. Next slide, please. So there are a lots, more options now for the kinds of specimens that can be tested than early on. The picture right in the middle of the slide is a nasopharyngeal sample, or a brain sample. That was really all that was available at first. Having a swab go way into the back of the throat. More common now, I think, are the nasal swabs, which can be, collecting a specimen either done by the person themselves or perhaps by somebody else who's able to collect it, but doesn't have to go too deep. Saliva samples are another thing that is very easy to use, and they've been validated with lots of different tests by now. And then also, at-home specimen collection kits are much more widely available than they were before. The specimen collection can be done either alone, or some companies have people do it on Zoom, and have the specimen collection supervised by a healthcare provider on Zoom just to make sure it's done correctly. And then the blood sample, of course, is for the antibody testing. Next slide, please. This is just a little bit of information on the types of test results for each test and what they mean. So, what does it mean when you get a positive or a detected? What does it mean if a test is indeterminate? There's a lot of information on this slide, but I think, one of the most important things about results is that, a lab will be required to get consent from the person who's having a test in order to release test results to someone other than the patient or the ordering healthcare provider. Logically, you might think that if you are paying for the test, you ought to be, you're entitled to the results of the test. That's not exactly the way that it works with laboratory testing. The patient needs to authorize release of results to anyone other than, themselves or to their healthcare provider, or if they're a minor, perhaps to their parent or guardian. So this is not a difficult thing to do. You've probably knowingly or unwittingly signed lots of consents for release of your health records before. It's a box that has to be checked with test results. Next slide, please. So just a word on the testing landscape today. It is much better than it was early on. There are more tests and more capacity. There are more labs that are performing the tests. There's a shorter turnaround time than you might think back to the middle of the summer. There are all the horror stories about the how long it took to get results back. Most of these problems have been addressed, and there's more testing being done than ever before. It's definitely still not as robust as it could be, and we're per capita not testing nearly as many people as some other countries are. But testing also is being used for a lot more than diagnosis now. It's also being used for screening and surveillance purposes. And just a word about when I say testing, testing is what happens in the lab, not specimen collection. So testing isn't somebody going through a drive-through and giving their specimen. That's just specimen collection. Testing is really what's happening in the lab, or when you are taking that specimen and figuring out, whether there's any virus present there. All of this, though things are better now, all of it is subject to change with surges and supply shortages, et cetera. What we've found is that when, just as predicted, when it got colder and people started spending more time indoors, and then the holidays come around, there's a lot more demand for testing, and that really does have an effect on supplies and just there's only so many tests that can be run on a lab's machines every day. So, but things are better, I think. Next slide, please. If you are doing a testing program, you know, I think the two most important indicia of quality that you want to look for is, first of all, you know, without a doubt, the laboratory has to have a valid CLIA certificate. This is a certification by the federal government that their processes are up to standards. They're, you know, basically looking for the quality of their processes and the, you know, that they know how to run the lab and that they have all the safeguards that they need to provide quality lab services that are going to be accurate and reliable. Also, there's a few states that require a state license on top of that. And then in terms of the test itself, with COVID testing, in general, this is not an absolute, but in general, a test needs an emergency use authorization, or an EUA, which the FDA grants, or it could be validation by a CLIA certified lab. They can validate the test themselves in some cases, but you know, checking for those things is important. Next slide, please. Just very quickly, I want to go over specimen pooling. This is something you may have heard about in the news, perhaps. This is a technique that is used really to save money and resources by testing samples in batches. So if you test a batch of samples and there's no virus detected, then essentially you can be fairly certain that all of the samples in the batch are negative. If you test a batch and the virus is detected, what you do is you go back and retest each sample individually or in smaller batches to find out which samples have the virus. This is a great technique to use, and there's lots of labs who are doing it. One of the hitches is that it really works best where there's a low prevalence, because when you have a high prevalence of disease in a particular community, whether it's, you know, the city you live in or the you know, the university that you're working at, you know, if you have a higher prevalence, then each of the batches is more likely to have a positive result, and you're going to have to test each of the individual samples anyway. But it's worth just knowing about. Okay, move on to the next slide, please. Okay, who pays for testing? That answer kind of depends on what is the testing for. There's a couple of different buckets here. There's diagnosis. This is somebody who has symptoms or has a known or suspected exposure to somebody with the coronavirus. Then you have screening, which is, you know, the return to school, return to the field, return to work, you know, where you are going to have a number of people in the same area and you want to stamp out those outbreaks or identify anybody who's infected right away. And then public health is a little bit different. That is more like surveillance testing. So in the city of Washington, what's the percentage, you know, get a sort of a probe sample almost, test a number of people and then sort of extrapolate, see what you can extrapolate about what's the positivity rate in this community. So those are different kinds of testing. Let's go to the next slide, please. The bottom line on who pays for testing is that, you know, for most schools and employers, they're having to pay out of pocket for testing programs that they put together, because generally they are going to be considered screening. You know, at the very beginning of the pandemic, Congress did require insurers, you know, group health plans and health insurers to pay for testing for coronavirus. After Congress passed that law, then the administration gets to sort of interpret it and put some parameters around it. And basically what the administration said is insurers have to pay, but only when the person is symptomatic or the person is asymptomatic but has known exposure. And so they sort of specifically said return to work and return to school is not, you know, not part of what insurers have to cover. So, so this kind of screening to detect or contain outbreaks doesn't have to be covered by insurers. Next slide, please. Okay. These are just a few considerations when you choose a lab partner. I'm going to let my partners from Eurofins talk more about how they operate with their clients and how they deal with some of these different issues. But again, making sure that the lab is CLIA certified and it's only going to be using tests that are authorized at this point, that they're going to comply with HIPAA, so privacy and protection of personally identifiable health information. Work on trying to agree on turnaround times. How long is it going to take for results to get back to you? We all know that results that take too long to get back, I think with every day that goes by, there's a little bit less value in those results because there's an opportunity for people to infect others, and in the interim while you're waiting for those results. Nail down with the lab who's going to get results, how they're going to get reported, and then also talk to the lab about do they need to get your permission to disclose that they're working with you, who's going to be responsible for those kinds of public statements, and then obviously money. It always comes down to money, but who pays and how much. All right, next slide, please. My last word on this is my focus has been on testing, which is important and essential, but it is not sufficient. This quote basically, testing is a belt and suspenders approach, but a belt and suspenders only work when you're wearing pants. So in this case, pants is social distancing, masking all the time, hand washing, disinfecting surfaces. Testing is one piece of the puzzle, but all of these pieces are really important, and you can't rely on just testing alone. I know that you're all aware of the number of games that have been canceled in different sports already because testing alone doesn't do the trick. I happen to be a Michigan fan. I was looking forward to the Michigan OSU game, and there you have it. So again, testing is really just one piece of the puzzle, and it takes all of these pieces together. I think we all know that by now, but it's I think worth repeating. So with that, I will turn it over to my partners from Eurofins. Thank you very much for your attention.
Alrighty, David and Troy, you should both be unmuted. I'm just going to switch over to your slide deck here. One moment.
So thank you for that. I think this just states the obvious at this point. What we're going to try to do is focus conversation a little bit more on what we've done in the past with some of our schools, our collegiate customers, both sports and our professional sports customers, in this concept of a bubble. And it'll probably be overused during the course of the rest of this conversation. But with that, I'm David Morgan. I run transplant for Eurofins, and transplant is a disease of infectious disease and immunology. And so we were drug into the COVID problem early on and developed a test. And with it, we received EUA approval, and since then have developed a lot of tests, either pooling or saliva, at-home collections, and some of the things that Joyce has talked about that are tools. And that's what we're kind of going to talk about, is the different tools that you can use in a bubble to create a bubble, and some of the other tools that may be used that are more economic than others, given the cost and who's paying the bills. And I'll turn it over to Troy for his introduction.
Hey, good afternoon, everyone. I'm Troy Ayers. I am currently the Education Channel Manager for what we call our Safer at Work program. What we'll refer to today as our Safer at Education and Safer at Schools program. I have a vast experience in public health workings through my education in food science and food microbiology, and extensive background in molecular diagnostics and supporting development of test kits for public health. So with that, and David, I can turn it back to you and take a dive into the slides.
Thanks, Troy. So Eurofins may be the biggest testing company that no one's ever heard of. We're an international company, and we have a lot of different tests in various verticals, 4 primary verticals: food and environmental testing. We're number 1 or number 2 in most developed countries in food and environmental testing. We have a biopharma testing division, which does a lot of biopharma products, and also clinical trials. We're actually doing some of the clinical trials testing for the vaccine, one of the vaccines that you hear a lot about on the news. And then we have a clinical diagnostics entity, and that clinical diagnostics entity is responsible for a lot of testing in Europe and a lot of testing in the US. We're probably doing in excess of, on peak days, 40,000 to 50,000 tests a day, COVID PCR tests in general terms. In the US and abroad, we're actually doing in upwards of 500,000 a day in Europe. And so we have a lot of experience in the testing piece of it. What we've had to do is figure out how to use the different types of tests to enable folks to get back to work, get back to play, and get back to school. Anything else on this slide, Troy?
No, David, I think that was a nice summary.
Okay, so this is a bit of a refresher for most, and I hope it's not too pedantic, but it's important because as we look at the different buckets, as you build your bubble, as you build your mitigation steps, as you identify potential problems, these are a good way to look at the population, whether it be the student population or the player population, the employee population. And primarily you're looking at symptomatic and pre-symptomatic folks that are spreading the virus. That's no surprise to anyone. The problem always comes into asymptomatic and to a lesser degree pre-symptomatic folks. And what can you do? And Joyce already alluded to it, right? It's not especially exciting, but it's the social distancing and the masking and taking those precautions and trying to build a safe bubble and keep any exterior possible folks that may introduce infection into the bubble away. And so the environmental piece we'll talk more about in the slides that are coming in this presentation, and we can do more offline. But this is an opportunity, I think, to focus on less expensive ways to monitor whether there is virus in your ecosystem, and if there is virus in your ecosystem, help build a plan to mitigate that, whether it's doing more pool testing, doing individual testing, periodic individual testing, whatever that is. But we're cognizant of the expense. We've been doing this for a while, so we get that the expense can quickly add up. Next slide, please. So this too, I think, is a bit of a remediation refresher. I think Joyce did a great job of explaining what everything is. Apologies, a bit of a busy slide, but I'm going to talk about these buckets, and hopefully it starts to, if you're uninitiated, make sense on how antigen and PCR, or in this case, viral RNA testing, work in unison for a comprehensive package on monitoring and creating a safe bubble. On the left-hand side in the purple, that shows nucleic acid or PCR testing. There's 2 types there. There's full extraction and there's non-extraction. The most sensitive is the full extraction method. Alluded to it. We have a link that I can send folks on the FDA website. We enjoy the top ranking of the most sensitive tests on the market. We share that with another company. And sensitivity is good in this because you're picking up folks that are asymptomatic or pre-symptomatic. And so that's an important solution, but it's longer turnaround time. It's where you get into the antigen testing where you can do point of care and you can get quick tests. And as they say, it's not so much the positive test you're worried about. Positive, it's positive. It's the negative test, and is it a false negative? And that's the issue. Is antigen testing just not as sensitive? And so there's a way to use both PCR testing or viral RNA testing and antigen testing in conjunction with each other. We use antigen testing, for instance, with the LPGA. We can talk a bit more about that in some later slides as a frontline opportunity to test the players, as well as some home testing that we do and some full extraction method testing. So it works in combination. And the cartoon there in the middle simply shows how the antibodies, the antigens, and the RNA interact. There's some bubbles on there with some more verbiage on the sensitivity and the turnaround time aspect of it. Next slide, please. So, and I've kind of hit this point home, but I want to stress that the comprehensive individual testing is probably the best thing you can do, and by that I mean the full extraction RNA method, non-antigen. But you don't a good program set up around the strong control measures, non-testing strong control measures that Joyce alluded to. You can also incorporate less expensive types of testing, be it pooling or environmental testing. And again, we'll talk more about that here in the upcoming slides. But this gives you kind of an idea of the relative costs for each, and how we look at it as we build our consulting and our spreadsheet and work with our customers to build a program so that they can safely get back to the activity that they're most interested in. So next slide, please. Turn over to Troy.
All right, thank you, David, for that nice summary and introduction into our Safer Work program. Now, here, what you're seeing is that we have a variety of sectors we're currently working with at Eurofins, including schools, and I circled recreation here because we're working with several college athletics programs across the United States. So some of the entities that we do work, some of the companies we partner with include the LPGA, Invicta, Mixed Martial Arts. We are a partner to the F1 racing circuit, and we're also working with K-12 private institutions across the U.S. testing children, teachers, and staff alike. So we'll go on to the next slide, please. All right, so the Safer Work program was developed by Eurofins to really ask that question, what can we do to go beyond clinical testing? We had a very, very good offering for PCR testing early on. It was being one of the first companies to receive an FDA EUA on our PCR test. Pardon me, but we could build upon that with the antibody testing and consulting services and so on. As you see, this wheel represents everything that we've evolved to today and services that are available across the country, around the globe, to help you identify COVID-19 in your populations as well as your environments. We'll address each of these briefly in a slide, and please know there's a lot of information in each slide that we won't dive into today, but you'll receive a copy of after the presentation for reference. So next slide, please. So as you've heard Joyce and David both mention, PCR testing is the gold standard for what we do today, and you know, really what everyone is looking for to detect the virus in their populations. A variety of options are available to you today as far as how do you get that PCR testing accomplished? What do you do? Well, many institutions have their own on-site health staff. They will refer to them to collect the specimens and partner with a lab that's convenient to them that gives the most robust turnaround time and the best service possible. Now, in addition, you can hire healthcare professionals for a day to do mass testing events. This can be accomplished through a drive-through, through a tent setup, or even a dedicated space within a given facility to collect those specimens. So you can hire outside medical experts to help you with this, or you can run it yourself. In addition, and in the last month or so, many self-collection technique methods have become available where you can do your own sampling at home and mail these in, which provides another level of convenience where you don't have to go out into public. You don't have to go into a larger group to accomplish PCR testing. Now, self-collection brings additional value to those entities looking to do testing because these methods can be conducted in the absence of a healthcare professional, making it much easier for samples to be collected and sent back to the laboratory. Those can be done at home. Those can be done on site through what we refer to as swab parties in various settings where you can accommodate 500, 600, 700 people at a time. Now, PCR testing, obviously you're going to hear that a lot today. It is the gold standard, and we urge you to consider PCR as your primary choice when making decisions on staying at school, returning to school, keeping your programs moving. So, next slide, please. Okay, antibody testing is both Joyce and David mentioned. This is something that's available today, but at this point, it's really more of a tool to determine if you've had pre-exposure. There's not a clear path forward on how this will fit into the availability of vaccines as they come along and are launched, but we'll just leave you with the thoughts on this slide and move on to the next piece.
Well, just a minute. I think go back one, please. Thanks, Trey. It is important to mention, and Joyce and I are part of a professional organization that's close to the regulatory bodies on how antibody testing will be used going forward. And I'm dismayed to admit that 9 months into the pandemic, it's still not absolutely clear. And as Joyce indicated, in the way that these are resulted traditionally, there's total antibody tests, and there's traditionally IgG, which suggests the presence of IgG antibody suggests immunity, and I say suggests because that's equivocal as well. How antibody testing will work pre or post vaccine, we still don't know. We stay close to this and interact with the CDC on a regular basis, but it remains to be seen. Now, post-vaccination, we will expect to see some sort of neutralizing antibody. And in the olden days, they used to do titers, the quantitative antibody testing, if you will, instead of qualitative, and it remains to be seen. This is as the information develops and the vaccine manufacturers provide guidance, we'll stay in front of that. Suffice to say, for your respective programs, know that antibodies right now are interesting. They don't provide a total answer, but they may come more into play when the vaccine starts to be administered in hopefully the second quarter of next year. Go ahead, Troy.
All right. Hey, David, thank you for the additional insight there. Okay, now I think we can go to the next slide. So, as part of the Safer at Schools strategy, we were thinking, what can we do to go beyond clinical testing? One offering that was developed is the concept of mask testing, warm mask testing. So if you have disposable masks, what can be done with these is they can be collected at various points throughout the day, pooled together in groups of 5 or 10 and sent back to the lab for testing. Now, this provides a lot of benefits and a lot of value to those that are looking to do something in addition to PCR testing and their surveillance programs by virtue of cost savings as well as very robust turnaround times. Now, the way this works is that 5 to 10 masks are collected. They're sent off to, in our case, our laboratory in Battle Creek, Michigan, and we can turn these around within a 24-hour time period from receipt at the laboratory. Now, some other benefits here. These are not tied to any one specific individual, rather a cluster or group or small bubble of people that you want to monitor for the presence of the virus without doing additional clinical swabbing. So When you send these off, you send us a group, you know who contributed to the mask pool. We give you that positive result back, and this can immediately trigger contact tracing, and additional PCR testing is needed of that group, because as we know, all the carriers are not symptomatic carriers, and that the majority of spread is caused by the asymptomatic individuals. So very, very useful tool that is available today. And these results don't get reported back into your local healthcare authorities per se, because it is considered a pooled method and a surveillance method for the group population. David, do you have any comments on this slide?
Nope. No. Next slide.
Yeah, next slide, please. Okay, environmental surface PCR. So this is yet another tool that you can utilize. We know that as you breathe in and breathe out, you expel the virus in an environment. This particular test was one of the first components of our Sentinel program. And we say Sentinel, what we mean is a program to put up a red flag or sound an alarm that the virus is in your facility or in your environment. So the way this test kit is used is to monitor shared spaces for the presence of the virus. It's an incredibly sensitive methodology. It also uses PCR. Same robust turnaround times that you'd see with the mass testing in under 24 hours. And the other way this can be used is to validate sanitation programs. So if you have a disinfection program and you know you've had an issue with COVID in your population, you can use this test kit to ensure that your areas are being cleaned. Okay. Any additions there, David?
No, thanks.
Next slide. Okay, wastewater testing. This is a very nice option that is available to not only schools and universities, but workplaces, manufacturing facilities. This is a great way for entities to monitor the presence of the virus in your overall population. If we think about the setting of a college campus where we have dormitory living, and you have, I'm here near the University of Florida in Gainesville, so we have many dedicated student athlete dorms surrounding the athletic complexes. So to monitor these buildings and operations for the presence of COVID without doing any additional testing is a very easy process. And the level at which you want to look at monitoring these buildings is really up to you. You can monitor the overall health of the facility and everyone in it, or you can compartmentalize the dorms by wing if you have access to engineering to tap into the wastewater streams. In many cases, it may be broken out by floor, it may be broken out by sector, or the building may be broken up into quarters, but you can monitor specific populations by looking at this measurable test for presence of SARS-CoV-2 in the wastewater. David, any comments on that?
So just as you start to think about these tools, the bubble, the players and how they interact, you see where whether it's the surface testing, the mass testing, or the wastewater, where these can be really economic ways to address the problem. And then internally, and we're happy to help, and there are other companies out there happy to help design a program where you have mitigation steps, right? So if you're doing wastewater testing and you find the presence of COVID in wastewater, and what do you do about it, right? Does it trigger a mass testing event? Does it trigger? Probably. And then what types of mass testing events? Does there additional quarantine? And there's some other tools you can use for contact tracing, tools that are readily available from the large tech companies. But these are ways, absent doing routine daily or weekly testing, where you can attack your problem much more economically. Go ahead, Troy.
Yeah. Thank you very much, David. Appreciate the extra insight there. These are all tools that you can utilize to support your surveillance testing of individuals. So an example I can give you is we work with one university that is doing weekly testing of their college athletes, and then they're supporting that with wastewater testing and/or surface contact testing. So good options here, good use of these tools that can also be very cost effective. Okay, next slide, please. Okay, air testing. This is a recent development that has become available to really measure the capacity of your air handling systems to remove the virus in your building or in a given space. These are very customized solutions that need to be targeted to the volume of cubic feet in a given area, as well as the traffic flow, and then taking into consideration the type of filtration system that's on site. Next slide, please. Okay, consulting services, as David just mentioned, you know, we can support. There's a variety of consulting services available today in the face of COVID, and as this pandemic has taken hold. I think when I think to how much the world has changed in the last 6 months, and the innovations that have come about to help people, help communities, and help our schools and institutions really understand, how do I tackle this problem? It's pretty mind-boggling. But you have access to experts that can help you devise clinical testing schemes with epidemiologists, as well as more technical people that can help you develop a strategic environmental approach to looking for and monitoring the virus in your given space. Okay, next slide there. Okay, ancillary services. So in Eurofins' case, you know, we're primarily a testing company, but we were thinking, how can we build something that'll just support anyone and everyone that needs help? What do we need to do to have a complete offering to anyone that needs support, as well as strengthening, you know, our position to be able to deliver the best quality when it comes to testing? So the first block on your left here, this is one of our third-party partners called Medable, who's developed an app that you can use that helps you do employee risk profiling. We have epidemiologists available to develop these programs, excuse me, that can help you develop employee screening techniques, everything from daily surveys and testing frequency to how do we track symptoms in our given population? Now, in the middle, David mentioned, you know, some sophisticated contact tracing. One of our partners is called GuardHat, and this is a Bluetooth device that works off of an individualized cellular signal that you can wear in groups. And I do know that many college athletic programs are implementing this strategy when their athletes are on site. When they're at the training facilities, they're in the dorms, they wear these devices all the time. And what this does, it gives you the ability to do real-time contact tracing of everyone wearing the device. Now, obviously, if they're not wearing the device, they won't get the benefit, but there's alarms that go off that notify you if you've been around someone for a given period of time. And then that data becomes immediately available to you for contact tracing should someone come down with symptoms or we hit a positive PCR test for COVID-19. Okay, on the right column here, you see healthcare provider. Now, one of our key partners is a company called Phoenix Medical Staffing, where we can provide on-site nurse staffing to assist companies and institutions with specimen collection that may not have their own resources. In the case of most colleges, we understand that there's a wide array of medical staffing that can be relied upon. So next slide, please. All right, when you're thinking about choosing a testing partner, you know, you want to make sure that the offering that you're looking at is comprehensive and consistent across the board, that implements, you know, the most stringent accreditations and certifications, as well as complying with regulations and having good options for you as far as, you know, how do we pay for this? How can we put something together that's economical and brings the most value to our organization as we consider our approach to testing? You know, the slide here is really an example of Eurofins' footprint and how we cover the United States. Now, you know, it says here that if you choose a lab that's within a 4-hour courier distance from your site, that is going to give you the best opportunity to get your results in the shortest amount of time possible. The other piece is volumes and capacity. If your service provider doesn't have capacities, and you think about today, we're reporting more and more COVID positive cases than ever before. Labs are busting at the seams, and unless they're continually striving to build out those capacities, they won't be able to keep up with the service level they were offering you, say, a month ago. So very important to consider these things as you look at a testing partner. David, did you want to add anything? Because I think this is our last slide.
Yeah, I mean, I think the only thing I'd add is, again, we're happy to individually talk about some of the lessons learned we've had with professional and other collegiate sport programs and designing tailored products and tailored programs. We've also have international labs I mentioned before. We've used that extensively with F1 and with the PGA as well as the LPGA for some, not all of the PGA tournaments, but some select ones. And so we can be helpful explaining more on how the sites interact with the types of testing that you may want to employ. Next slide. So I think that's how you get a hold of us. So we wanted to make sure we left some time for questions. And even if it's a redirect, both Troy and I are happy to get involved and help you, as I'm sure Joyce is as well, and answer your questions and give you our advice and our hard-fought lessons learned, having made as many successes as mistakes over the course of the last 9 months. And we're eager to help you and your students and your athletes get back to play and work. Anything else, Troy or Joyce, before we turn it over to questions?
No, I'm good to go, David. Joyce?
Joyce is probably being unmuted right now.
I am just being unmuted. No, I don't have anything else to add there. I know that's a lot of information that we all shared, and this is the space that we work in. It's sort of second nature to us to talk about this. It's a lot for a lot of people to absorb and to try to put the pieces together. I just encourage you to take a look at the slides and reach out to any of us, even if you just have questions or want to know how others are handling things. Any of us would be happy to talk to you.
Hey, this is Hannah from LEAD1 here. With that, I can go ahead and read off a couple of the questions that have come in. Just a quick reminder to the audience, if you do have a question, feel free to shoot it in that questions tab, chat box, or if you want to raise your hand, I can unmute you individually. First question up. In the early fall, we were getting results back within 24 to no later than 48 hours. Now with the increase in testing numbers, it is taking us 5 days to get the results back. And with the way things are trending, this turnaround time could probably increase. How do we address the requirement to provide a test no later than 72 hours prior to a competition?
I'm happy to take that. I think, and Joyce can probably opine on the industry writ large. There has been turnaround time issues. Thankfully, we enjoy a 48-hour turnaround time, and that's usually 24 hours from receipt. Receipt is sometimes complex as well. There's been delays in FedEx and the availability of commercial flights to transport specimens across the United States to our different laboratories. There's less and less flights, as everyone can imagine. So logistics is a challenge. That's why in our one slide we said when there is a courier available, one of our closer our laboratories, that is absolutely the best practice. Listen, we help our industry partners and for lack of a better term, competitors, and we do what we can to move work around internally under the auspices that this is about people's lives, and we need to help each other out as we can. I see when there is spikes in turnaround time, and call it beyond 72 hours, they're quickly rectified. I have a lot of faith in that we are going to continue to build capacity. We Eurofins If you look at the other major national laboratories, whether it be LabCorp, Quest being the two primary, but certainly BioReference, Sonic perhaps, Mayo, ARUP, everyone is still working on building capacity. So I hope if the testing increase, the need for testing increases, so too will be the capacity. It's everyone's goal to meet 48 hours. In fact, and I'll let Joyce answer the rest of this question, the government has actually contemplated changing the way they pay for things beyond than 48 hours. And so that is what all of the industry is striving for at this point. And I'll turn it over to you, Joyce.
Yeah. So, you know, what he was referring to is starting on January 1st, Medicare is going to essentially, you know, drop the price that it's been reimbursing labs for the PCR test. But when the test is, the results are reported out within 2 days, and the majority of all of that lab's COVID tests in the previous month were reported out in less than 2 days, the lab is eligible for a bonus payment. So this is like an incentive, not only to make sure that Medicare beneficiaries are getting their tests turned around quickly, but because of that, that other criteria, that the majority of the labs, all of the labs tests, whether they're, you know, tests performed for employers or schools or for commercially insured individuals, the majority of all those tests have to be turned around within 2 days in order for a lab to be eligible for this bonus payment on the Medicare side. So, you know, every lab is going to be incentivized to make sure that they're doing everything that they can to decrease that turnaround time so that they have access to that additional bonus payment. And, you know, I think it's true, you know, from what I see from the American Clinical Laboratory Association, where I'm the general counsel, that Eurofins and LabCorp and Quest and Sonic and BioReference are all a part of. There's a lot of collaboration going on between the labs in terms of if a lab, you know, a lab partnering with other ones, if they're going to have essentially too many specimens to be able to test, to have basically a you know, a safety valve so that they can send some of their specimens to a different lab that they're partnered with and refer those out. I think that, you know, on the practical level, you know, one of the things that I've seen different labs doing is they have agreements with their clients that they will turn around their samples within X number of days, or you know, or the client's not paying for those. You know, that may not be something that's very popular, but it's something where, you know, where a lab that isn't worried about putting that kind of clause in, you can be fairly certain that they're going to do their very, very best to be able to turn that around, and that they have some of these systems in place to be able to do that. The other thing, and I think that this is really important, is partnering with a lab that's as local as possible. You know, it doesn't have to be right there in your city, but to the extent that you can minimize having to use commercial couriers, you know, and you know, put something on an airplane to get to a lab, and you're able to drive it a couple of hours, or you know, just have that be fairly certain that it's going to get there by the next morning. That's another way to address that and to mitigate those risks as much as possible. But it's something that lots and lots of folks are dealing with all at the same time. It really is a very big challenge.
Great, this is Hannah again. It looks like we have no further questions, so I am going to go ahead and close us out for this afternoon's webinar. Thank you to our panelists, David, Troy, and Joyce, as always, for taking the time out of their afternoons. We'd like to thank Eurofins again for sponsoring today's webinar. As I mentioned in the beginning, this webinar will be circulated alongside a written recap and a copy of the slide deck within the next 24 hours. But with that, enjoy the rest of your afternoon, and we will see you again soon. Thanks again.
Thanks, everyone.
Thank you.
Thank you very much.